Yes, you can start.
Topic for the today's session is herpes virus. First one is the introduction. Herpes virus belongs to the family Herpes viridae. It has an enveloped DNA. It has an icosahedral core surrounded by a lipid protein envelope. Herpes virus is a linear double-stranded DNA. It is a large virus and measures about 120 to 200 nanometer in diameter. Capsid surrounds DNA core, and over the capsid is tegumen. It is a protein-filled region. Nuclear membrane-derived lipid bilayer contains viral glycoprotein. Next one is the classification. Human herpes virus 1. The common name of human herpes virus 1 is herpes simplex virus 1. It belongs to subfamily alpha herpes virinae. Human herpes virus 2. The common name is herpes simplex virus 2. It belongs to subfamily alpha herpes virinae. Human herpes virus 3. Common name is varicella zoster virus. Subfamily is alpha herpes virinae. Human herpes virus 4. Common name is Epstein-Barr virus. Subfamily gamma herpes virinae. Human herpes virus 5. The common name is human cytomegalovirus. It belongs to subfamily beta herpes virinae. Human herpes virus 6. Human herpes virus 6 variant A and B. It belongs to subfamily beta herpes virinae. Human herpes virus 7. Common name is human herpes virus 7. Subfamily is beta herpes virinae. Human herpes virus 8. The common name is Kaposis sarcoma associated herpes virus. Subfamily is gamma herpes virinae. In this today we are going to see about the alpha herpes virinae family. First one is the herpes simplex virus. Herpes simplex virus type 1 and type 2 are distinguished by two main criteria. First one is the antigenicity. Next one is the locations of lesions. Antigenicity means it can ability to combine with the final product of immune response. Human herpes simplex virus 1, it will occur the infection above the waist, which means above the abdomen. Primarily, it will occur in adults. Acute gingivostomatitis will be there, which means inflammation of mouth and gums. Recurrent herpes labial will be there, oral herpes and encephalitis. Next one is the herpes simplex virus 2, which will occur below the waist. Herpes genitalis will be there, neonatal encephalitis, other forms of neonatal herpes, aseptic meningitis. Cause for the human herpes simplex virus is humans is the natural cause. Herpes simplex virus replication. First, the DNA will be released into the cytoplasm. Next, the DNA will migrate to the nucleus. mRNA synthesis will take place in the nucleus by using host RNA polymerase. Next, the mRNA will be transported into the cytoplasm. From there, new viral protein made and migrate to the nucleus. Genomic DNA synthesis take place in the DNA by using viral DNA polymerase. Transmission. Herpes simplex virus 1 is transmitted primarily by saliva, and herpes simplex virus 2 is transmitted by sexual contact, oral genital sexual activity. Herpes simplex virus 1 will cause lesions of the oral cavity, and herpes simplex virus 2 will cause infections of the genitals. Next one is the clinical findings of herpes simplex virus 1. Herpes simplex virus 1 will cause several forms of primary and recurrent diseases, that means gingivostomatitis. It will occur primarily in children and it is characterized by fever, irritability, and vesicular lesions in the mouth. The primary disease is more severe and it will last for longer. The lesions will heal spontaneously within 2 to 3 weeks. Many children are asymptomatic in primary infections. Next one is the herpes labialis. Fever, blisters, or cold sores is the milder recurrent forms. It is characterized by crops of vesicles, usually at the mucocutaneous function of lip or nose. Recurrences frequently appear in the mouth. Clinical findings: keratoconjunctivitis. It is characterized by corneal ulcers, lesions of the conjunctiva. Recurrences can lead to scarring the blindness. Next one is the herpetic whitlow, pustular lesion of the skin of the finger organ. It will occur mainly in the medical personnel as a result of contact with the patient's lesions. Next one is the herpes gladiotrum. It will occur mainly in the wrestlers and others who have close body contact. The vesicular lesions mainly occur in the head, neck, and trunk. Next one is the disseminated infections such as esophagitis and pneumonia. It will occur in the immunocompromised patients with depressed T cell function. Clinical findings of herpes simplex virus 2. Mainly it will occur genital herpes. It is a painful vesicular lesion of male and female genitals and anal area. The lesions are more severe and protracted in primary disease than in recurrences. Primary infections are associated with fever and inguinal adenopathy. Asymptomatic infection, source of infection of other individuals in men, prostate or urethra is affected, and in women, cervix is affected. Neonatal herpes, it originates chiefly from contact with vesicular lesions within the birth canal. It varies from severe disease to milder local lesions to asymptomatic infection. It is prevented by performing cesarean section on women with either active lesions or positive viral cultures. Neither herpes simplex virus 1 or herpes simplex virus 2 causes congenital abnormalities to any significant degree. Erythema multiforme. Both the herpes simplex virus 1 and 2 infections are assessed with erythema multiforme, which means central red area surrounded by a ring of normal skin outside of which is a red ring. Targeta bull's eye lesion will be there. Lesions are sometimes macular or papular. Many drugs, especially sulfonamide, among the antimicrobial drugs, commonly cause erythema multiforme. Erythema multiforme is also known as Stevenson-Johnson syndrome. It will cause fever, erosive oral lesions, extensive desquamating skin lesions. Laboratory diagnosis, isolation of virus from the lesion by growth in cell culture. Typical cytopathic effect occur in 1 to 3 days. It is identified by fluorescent antibody staining of the infected cells or ELISA. Sang smear is used for rapid diagnosis. GEMSA stain, multinucleated giant cells present in vesicles. Human herpes simplex virus DNA is detected by PCR. Next one is the treatment. Aclocyclovir, peniclovir, declosanol, valcocyclovir, famiclovir. Prevention, avoiding contact with vesicular lesion or ulcer. Caesarean section is recommended for women who are at term and who have genital lesions or positive viral cultures. Vaccine, no vaccine is there. Trial is going on. Recombinant herpes simplex virus 2 glycoprotein. Thank you.